what we just discussed, but this one is just generally a ruptured pelvic abscess. So what is the pelvis? The pelvis is that lower, part of the body, between the abdomen and the lower limb, okay, where you have the reproductive system there. So you can have abscess collection there. Now you have a lot of organs there, and any of those organs could actually have collection of pus in it. So for those organs, the organs that could possibly have collection of pus, we'll also list them out, okay, and we'll talk about everything. So ruptured pelvic abscess, just so you know, anything that has to do with abscess rupturing is a life-threatening emergency, and it requires immediate medical attention. You have to recognize it early, and you have to intervene early. So what happens when it ruptures? When abscess rupture, the pus and the bacteria can spill into the peritoneal cavity. It can cause inflammation of the peritoneal cavity, that's peritonitis. Some of the bacteria could get into the bloodstream, causing sepsis. So there's a high risk of the person dying from such a condition if it is left untreated. So what's the clinical presentation? There's sudden severe abdominal pain, there's fever, chills, and tachycardia, rigid abdomen, rebound, tenderness and guarding, hypotension, tachypnea, confusion, okay, nausea and vomiting, and generalized tenderness. So what's the emergency treatment for ruptured pelvic abscess? Of course, you hospitalize the person, and because there's a spill of pus and bacteria into the peritoneum, you have to put the person on broad spectrum antibiotics just to prevent any possible infections from coming up. So surgical interventions that you could do include things like laparotomy, laparoscopy. Then if there's any dead tissues, you also remove it. So removal of necrotic tissues, you remove it, okay? So you also place the person on intravenous fluid, pain management, close monitoring for sepsis or organ failure. Alright, so that's what we got. So complications is this, because septic shock could lead to multiple organ failure. So many organs could fail in such an individual, and many organs could get contaminated, leading to the individual suffering from infertility. So sometimes the individual could actually suffer from pain, okay, for a very long time. That's chronic pain, adhesions and bowel obstructions, and there's increased risk of ectopic pregnancy. That's when the individual tries to actually get pregnant later on after the complications. So that's it